Hello everyone, and welcome to today's session, which is also about occupational therapy 2. Now, this is the fundamental class on occupational therapy. The first video you saw is based on the basic knowledge and the foundational knowledge of occupational therapy. Now, what's occupational therapy? Occupational therapy is also known as OT, and it is a health and rehabilitation profession that helps people of all ages do the everyday activity that are important to them, even when they have physical, sensory, cognitive, emotional, or developmental challenges. So, this is where your job comes in as an OT, because the child you're working with, if they have special needs, it might be a physical issue, it might be a sensory issue, it might be cognitive or developmental challenges. So OT focuses on function and not the medical condition. So a child has autism, you have no business with whether the child has autism, you have no business with whether the child has ADHD. Your own is to make sure that they are functioning correctly. So it's not be you're diagnosing, oh, he has stroke, oh, he has, no, that's not your business. So it's to help the person eat independently, dress themselves, write in school, participate in work or play. Now, what's the meaning of occupation? We know occupation, right? But in OT, occupation does not only mean a job. It means any meaningful activity that fills a person's day. So occupational therapy is more like a daily life activity. Okay, like self-care, school tasks, work activity, play, leisure, movement, and social interaction. So if someone cannot do those things well, OT intervenes. So what is your role as an occupational therapy? Your role is to observe, is to identify and develop strategy, then modify tasks or the environment. For example, because as an occupational therapy, you might not necessarily work with only a special needs child. You might work with someone who has arthritis, who has rheumatism, who has stroke. Okay, you're helping them to gain back their life skill. So if you are working in a hospital, it means you'll be making more money than working with a special needs child in school. If you are working in a nursing home, it means you'll be earning more than working with a special needs child. So occupational therapy is actually broader. Okay, because the goal you have is to build independence, participation, and quality of life. Then what's the core principle? Your core principle is that you're client-centered. It's not about this is what I learned, or this is how they taught me to work. No, you are client-centered, you're holistic, which means you're dealing with all developmental factors, functional, goal-oriented, and evidence-based. So what are the models? The model will help you, the therapist, understand why a person is struggling. Okay, is it the person environment? So we have PO, we have MOHO, and we have SIM. So PO is the PEO, which is the person, environment, occupation. Now the model here looks at interaction between the person, the environment, and the task. So for example, a child that's having sensory issues, noise is, as in they're making noise in the class. It means when you're checking, you have to, the modeling means that you have to pull the child out of the class to work. The model of human occupation, this focuses on the child's habit or routine. Like a child will not function until he or she has eaten, or a child will always want to sing before they start a task, or a child is used to using noise cancelling headsets. It means we have to work with that child's habits, routine, then focus on motivation. So you use that to now help the child or the person build the needed skill. That is MOHO. Then SIM is sensory integration model. This explains how the brain processes sensory input. So you know about sensory input when you do your sensory integration core class. And so this is commonly used actually with children that has autism or ADHD. The client center practice. I think we should just skip all these. These ones are basic things that you know already. So now what's the areas of occupational performance? We have ADL and we have IADL. So ADL is activities of daily living, which is your normal independent living, bathing, dressing, eating, toileting, grooming. And you assess, then you help the person improve their ability to perform these tasks. Okay, so the work of an OT is to give people sense of belonging, to give them autonomy, to improve their quality of overall quality of life. Okay, so your work is more than just our autism and ADHD. Then IADL means this one is when you work with adults. It means it's helping them to build on tax independence that will help them manage their finances, their cooking, their shopping, their cleaning, transportation. So it means that you are helping them build their muscles. You're helping them, so, because once some people have some brain surgery, they suddenly forget how to do some things. So this now is going to help them gain back those skills. Then we have pediatric versus adult focus in OT. So in pediatric, that is the child. You are working on the child's play skill as an OT. You're working on your school participation, which means the child, you're working on the child's sensory skills. You're working on the child being able to hold their pencil well, being able to write well. You're working on the child being able to feed themselves, being able to potty train. So as an OT, you are helping the child to potty train because it's part of their ADL, their sensory regulation and their fine motor development. But if you're working with an adult, your focus will now be on just 4 things: self-care independence, work productivity, community participation, safety, and mobility. So basically, OT are the ones that letters want to do. You know, when some people want to jackpot, yeah, what they go do abroad is that they go work with old people, they go work with people that need care, they go work with people that are recovering. Okay, so OT basically, if you also have a nursing care or a nursing assistant certificate, you'll be able to work with an adult going through this. So before you take up a job as an OT, you need to do assessment. Okay, the assessment of OT is different from the autism or ADHD or learning difficulty kind of assessment. And this you need to notice. So before you do your assessment, check out for the purpose. Check out for the purpose of your assessment. What's the purpose? So the first purpose is you want to just have to understand the WH. So your WH from what the person can do. Okay, can this child feed him or herself? Can this child climb staircase? Can this child carry objects by themselves? Can this child put cup to his or her mouth to drink water by him or herself? Does this child react to this? So now what they struggle with? Do they struggle with baiting? Do they struggle with brushing of their teeth? Do they struggle with carrying of their bags? Do they struggle with social interaction? Now, why is this difficulty existing? So why is this struggle existing? Is it genetic? Is it from birth? Was there a sickness somewhere? Was the child diagnosed with autism or ADHD? So you will know how to attend to it better. Then what supports are needed? An assessment with OT is not a one-time thing. You keep assessing every time. You keep assessing. You might assess every 2 weeks. You might assess every 1 month. But assessment for OT is not as long as assessment for autism and ADHD. Now, what are the type of OT assessments? We have observation, which is where you watch when the child, you're giving the child tasks to carry out, you're watching when the child is carrying out the tasks. You interview. So you get information from either the client, you get information from the caregiver, from school, from whoever referred you. Then task analysis. So this is where you now start breaking the tasks into steps. Then standardized tools. These ones are formal assessments. This formal assessment, you might not be the one to do that except you're being certified as an OT. So what are the areas you can commonly assess? So you assess the fine and gross motor skill. You assess the sensory processing. So you understand what sensory processing is when you've done your sensory integration class. Attention and cognition, emotional regulation, and functional independence. So intervention planning, this is you base it on assessment results. Link it to functional goals, then adapt it to the client's daily life. So it's not like, as I said, it's not like regular therapy. Because this one now, the child eats every time, the child walks every time, the child baits every day, the child wears clothes every day, the child's own life, the child hears noise every day. So OT is a daily life therapy. So these ones are individualized. You can't say, oh, well, let's use this person IEP for this person IEP. Nah, it's individualized. Then common OT interventions, skill training, which is handwriting. You can teach how to lace their shoes, how to wear their clothes, how to take their bath. Sensory regulation strategies, environmental modification, which where you have to make sure they are aligned with the environment, either from noise to light to smell to stimuli to feeling to what they eat to what they touch. Adaptive tools and equipment, these are where you standardize your fidget toys, your kinetic sand, water, sand, whatever it is that needs to help with to help them to adapt. It might even be some might use working aids, some might use noise cancelling headphones. Then routine and habit formation. Now, fine motor intervention, this focuses on hand strength, coordination, graph development, and handwriting readiness. An activity may include puzzles, cutting, drawings. We all know that already, yeah? Then sensory regulation strategies, these are used for individuals that are over responsive or under responsive. So they call them overstimulated or under stimulated. So the strategies now include movement break, deep pressure, calming activity, and environmental adjustment. Okay, so you learn exercises that are done under each of these. Okay, so the next one we have here is ADL training strategy. This is where you teach daily life skill by breaking the tasks into steps. For example, you want the child to start feeding themselves. What you first need to learn is how to lift up spoon, lift, drop, then how to just use the spoon to stir in their food, take it to their food. Then they now need to, okay, from their hand to their mouth. So it has to first be a size of lifting, then from hand to mouth, before they now start even put the spoon to their mouth to eat. Then so it has to be broken. Then also you have to use visual schedules. Anyone that works with special needs will know that visual schedule is a big thing. Build routines, encourage independence gradually. Know that you must do within. No, for OT you can't say it must happen between so and so. No, because you are not the child's body. Okay, you're not the child's body. You're not the person's body. So when the person's body is adapting to it, is accepting those things, that the person will automatically start doing those things. Then pediatric and school-based OT. So OT support children with autism, ADHD, learning difficulty, and developmental delay. And the focus area is classroom participation, handwriting, attention, and self-regulation. For a child that cannot sit still to listen to tasks, for a child that cannot copy notes from the board well on their own, that's not handwriting is difficult to. Now the child is that they can't lift up their arm appropriately, or they can't write for long because their arm aches. Then we have adult and community OT. This OT helps adults with stroke recovery, arthritis, injuries, and aging-related challenges. Okay, so your goal here now is to give them a safe and independent living. Then working with families and teams, you must collaborate with parents, teachers, therapists, and medical professionals. So OOT works with these 4 sets of people, because what? Teamwork improves the outcome. Now, case study application, you get that there's a part where you have your case study. So you go to your case study and you see the practical tasks. Then you can do that. It will help you a whole lot. So what are the ethics and professional boundaries? No matter how, because one thing about OT is it makes people relate to you like family, because you are helping the child in their daily life skill. So you must maintain confidentiality. They don't want to see their record out. They don't want to see their faces. Not because you want to have proofs. You're not having recordings. They don't want to see it. Like people are brought, some people are deported because of that. They don't want to see how how good you are with them. Nobody asked you for it, so don't send it to them. Don't make videos. Don't post. Don't share. Don't even talk about them. Don't even use initials, because their families might be watching you online. Respect dignity. Like you see some cases where a child is tapped on the head, or the child pulls, and then the next thing the person is spanking the child. This child is still going through potty training, which means you have no right to touch that child if the child messes up themselves, because that is your job. Practice within scope and be culturally sensitive. Now, things that you might not count in Nigeria will count in some other countries. Things that might not count in your home will count in another, in some other way in another family. For example, a family uses tissue to wipe. You say, no, because I'm the therapist, let me use water to wash. And I tell you, no, we don't use water here. You can lose your job. You can lose your job. And the next is progress. So how do you measure the progress? You measure it by functional improvement, goal achievement, the goal you wrote down in your assessment, goal achievement, then client or caregiver feedback. So the short summary, its key takeaway is just that OT is functional and client-centered. Small changes create meaningful impact, and everyday activities are powerful therapy tools like walking, strolling, jumping, climbing up staircase, wearing of socks, putting on clothes by themselves, buttoning their clothes, zipping their clothes, combing their hairs, brushing their teeth. For those that are teenagers, cooking, those are important things. So if you're an OT, if you want to be, you aspire to be an OT, you are holding the life of people in your hands daily. I'm Empress Selma Igwe, the anointed teacher, and see you in the next class.